Remember this, read from Das. Lump is a vague mass of body tissue. Swelling, anybody knows definition of swelling? Swelling? Swelling, definition. Nothing. Swelling is a vague term that denotes any kind of enlargement or protuberance of body tissue. Okay. So these are the basic definitions. Then there is neoplasm. These definitions you should learn by heart. What is neoplasm? It is growth of cells without the need for the body. Growth of new cells, independent of need of the body. Okay. So we'll proceed on to swellings. So I'll give you a short understanding about swellings. Rest you have to read from Das and come again, and we'll discuss next week. Next week also I am only going to take your class. We'll discuss at the end what we want to discuss upon. Okay. So anybody knows anything about the examination of swelling? Somebody wants to help out? No, first the basic inspection. First you should always start with inspection. Okay. Before that, history. Before that is history, but this is a short case. The examiners are not going to ask you so much about history and all. First is history and then inspection. In inspection, anyone? Shape, okay. Mobility will be in inspection or palpation? Surface, okay. Then fixity again will be on inspection or palpation. Fixity, can you do it on seeing? Okay. Then color, okay. Site, size, shape, surface, margins, if any visible margins of color. Redness comes in color. Apart from that, skin changes, okay. Mobility is in palpation, we just discussed, right? Okay, then location, site, that comes in site. It is easier to remember. Site, size, surface, then number of swellings, okay, if there are multiple. Can you give me an example of multiple swellings of the same type? Okay, okay, that works. Apart from that, something very classical, lipomatosis. Multiple lipomas are called as lipomatosis. This is all there in the book. So I'll just give you a rough understanding. So get Das from next time. And for basic examination, do not refer to any other book apart from Das. I understand ML Saha has questions in the end and everything, but Das is going to help you for a lifetime. If any of you try to choose surgery, Das will help you even in your post-graduation also. So it is always better that you read from Das from day one. Okay. Inspection is done. Let's come to palpation. Palpation, what all? In palpation, you can first thing should be I confirm my inspectory findings. Okay, then what will be? Site, size, shape, surface, extent, consistency, tenderness, fixity, mobility, plane of the swelling. Plane of the swelling is very important. Can you give me an example where plane has to be defined? A classical example, something that is around the neck. Branchial cyst is no. Thyroid. When you get a thyroid swelling, the examiner is going to ask you that what is the plane of the swelling, because that plane will help you decide whether it is a thyroid swelling or something superficial, some lymph node. What will be the plane for thyroid swelling, if anyone knows? Deep to deep cervical fascia. In any ways, okay, this you'll learn gradually. Okay. Then, apart from this, palpatory findings. Pulsation. Okay. Any visible pulsation? Okay. Fluctuation. Yes, fluctuation is there. Okay. What do you do in fluctuation? Anyone? No. There are three ways to do fluctuation. You guys are going to clinics, so you should know what is fluctuation by now. Somebody tell me what is fluctuation. There are three methods of doing fluctuation. One is for a normal swelling. So for fluctuation, for the first type of test, what you have to do is you have to use each finger of two hands, of both the hands. So you put it placed at the farthermost position. From both the fingers, you fixate on one with one finger and press with the other finger to see if the swelling hits on this finger. That is the first test. Second, if the swelling is too small, what do? Can you, No, that is another, that is for larger swellings. That for mobile swellings, what you have to do is you have to fixate with one hand. These two will fixate, and on perpendicular direction, you have to palpate, do fluctuation with the other hand, sorry. That is how you do for the second. What is Paget's test now? Tell me, when do you do Paget's test? Not Paget's disease. This is how the examiner will get. From a simple short swelling, the examiner will enter into breast, and even if you've read swellings properly, you will still fail, because breast, they will go on to so many planes, you will not be able to uncover that plane. In any case, Paget's test, what you have to do for small swellings, you will not be able to hold the swelling. So Paget's test help you differentiate between a cystic and a form swelling. So for small swellings, if the center is soft, what do you feel that will be? Cystic. Center is soft, it means cystic swelling. If the center is formed, then it means a form swelling, solid swelling. Okay. Apart from that, after palpation, read in details about inspection and palpation, whatever properly the book has given, because after this, we'll come on to individual swellings. We'll discuss it in brief, and next week I'll be asking you questions upon it. Okay. 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 Then let's come to inspection, palpation, and auscultation. When would you like to auscultate a swelling? When do you feel you should auscultate a swelling? This is a very basic question. Obstruction of bowel sounds. Okay. Where do you get a swelling in the GIT? You tell me now, now that you've told me. See, whenever you give a viva, be very structured. Right now I understand you are just starting your final year, but giving a viva is also an art. So do not say something that you are not sure of, because from here on I will go on to lipoma of the gut, into susception, and from here onwards your viva will go full wrong. So in any ways, when will you auscultate a swelling? Anybody has any understanding? Very simple. Why do you auscultate? For what do you auscultate? Vascularity. Exactly. Then, when will you auscultate a swelling? If it has increased vascularity, or if it is a vascular swelling, right? To determine if it is associated with an artery. Does anyone know about any vascular swellings? Anybody knows about hematomas? Okay. So auscultation is done. Then today the class will keep it brief, but I expect all of you guys to read about swellings and come the next week, because by now you should read DAS, especially the first 5 chapters. History taking, swellings, all these things you should know by heart. Okay. Okay, no, before that, first tell me, you should know about the plane of the swelling. How will you understand the plane of the swelling? This is an important question, knowing the plane of the swelling. What can be the different planes? That is very basic, right? Anybody, you tell me. Sit. Different planes of a swelling. No, that is sections. I am not that section. See, understand the layers of the skin, right? Anything under a skin, that layer you will understand that the plane of the swelling is just underneath. So that will be subdermal, submuscular, like that. Okay, so this is basic. You should know this. Okay. So for, let's say, how will you understand whether a swelling is above a muscle or underneath a muscle? Muscle can be palpated, no. Something very basic. See, if it is inside, underneath the muscle, then what will happen when you make the muscle taut? Will the swelling become more prominent or will it disappear? Disappear, exactly. And if it is above the muscle, then what will happen? Let's say if the swelling is in my biceps, right? If I make my biceps taut, and the swelling is above the bicep, what will happen? It will become more prominent. So this is how you understand the basic plane of the swelling. So similarly, just like biceps, in different muscles of the body, you should know how to make what taut. Like for breast, if you've done breast examinations, you know, right, that did you read about breast examinations? Acha, no. So when you read, you will know that fixity to serratus anterior. In breast, there is a term called as fixity to serratus anterior. In that case, you have to make the serratus anterior taut to see whether the swelling is above the serratus anterior or underneath it. Similarly, there are for different muscles, there are different examinations that is given in DAS very nicely. You read. I will be asking you for each muscle next time, because this way the class is not, because if I keep on telling, then there is no learning. You will just similarly like explain what happened. Was anyone there in the surgery OPD? I think he was there. You were there, right? Abhi right now OPD class, your batch was not there, kya? You were there, no? So still you guys were not able to answer about spleen. So we'll do an interactive class, because it's not like I'm doing the class for myself, I'm doing it to help you guys. So read and come next week, it will be more educative that way for you guys. Okay. So let's come on to the individual swellings. I will cover it in short, the individual swellings, just the basics. Rest all you'll have to read and come. So the basics that will be needed for your exam will be, first will be lipoma. Does anyone know what is a lipoma? Okay, tell me. It is a swelling arising from mature fat cells or adipose tissue. Okay. Now tell me, like, has anyone ever palpated a lipoma? Today morning that case. So lipoma contains fat, it is soft to feel. Okay. Mobility, yes, it will be, yes, it will have mobility. अच्छा, ठीक है, तो three swellings we should know very well about. One is lipoma, that arises from mature fat cells or adipose tissue. Second is dermoid. Dermoid is because of improper fusion of embryonic lines, a swelling arises. So that is called as dermoid. And sebaceous cyst. Sebaceous cyst is when the punctum of the sebaceous gland gets blocked, there is collection of sebum. That leads to formation of a sebaceous cyst. These three swellings you should know by heart. If in an exam you are not able to tell about these three swellings, you will not pass. Okay. So apart from that, vascular swellings are also there. So let's discuss about different types of lipoma right now. Lipoma can be of different types. One, based on the plane of lipoma, right? There is one submuscular type lipoma. There is capsulated lipoma. Then apart from that, capsulated, submuscular, and multiple lipomatosis or tender lipomatosis, that is Dercum's disease. Okay. Okay. And then what do you do with the swelling, the lipoma? Does anyone know the treatment of lipoma? And also there is one diffuse lipoma. In diffuse lipoma, you will not be able to understand the margins of the swelling. So why is it important to understand and diagnose before operation? Can anyone tell me, just from basic understanding, why is it important to define what type of lipoma, whether it is diffuse or capsulated? Anyone? Why do you want to understand whether it is diffuse or capsulated? Go ahead. Yes, exactly. So this happened once while I was operating 5 years ago. I did a lipoma and I tried to take out all the tissue. But turns out my senior just joined me and then he's saying you've not taken out the tissue. So this is why it is important. If it is a diffuse lipoma, you have to go into deeper planes to check out till what extent the lipoma is present. So only that diagnosis should be made before operating, whether it is diffuse or capsulated. Capsulated is more firm because it has a capsule over it. Okay. So basically for lipoma, we have to excise the lipomatous tissue. Let's come to sebaceous cyst. I'll be discussing in short. because I expect you guys to read and come the next week. I'll be asking questions next week. Sebaceous cyst, again for sebaceous cyst, the classical feature is there is a visible punctum, which is seen in 70%, 80% of the cases you will see a punctum. Lot of cases don't have punctum also. Apart from punctum, you will see sebaceous cyst is always fluctuant, but not transluminant. Okay. So a few examples of sebaceous cysts. There are different types of sebaceous cysts. So sebaceous cyst in the scrotum, also you must have seen the Bailey and Love, that textbook, that Horner's horn in the beginning. That is also a sebaceous cyst. Okay. So let's come to the excision of sebaceous cyst. For excision of the sebaceous cyst, you should make sure that each and every part of the capsule of the sebaceous cyst is removed. Otherwise, there will be recurrence. If any part of the sebaceous cyst is remaining inside, there will be recurrence. So in the sebaceous cyst, we give an elliptical incision. Okay. Apart from that, let's come to dermoid. I'll be discussing in very short this time in brief, and then to same dermoid. There are 5 types of dermoid: tubulodermoid, implantation dermoid, and ectodermoid. This 3 is there, and okay. Apart from these 3 swellings, there are other swellings as well. Ganglion. Ganglion. Can anyone tell me what a ganglion is? Yes, it is a swelling arising from the nerve fiber sheath because of correction of fluid in the nerve fiber sheath. Okay. Apart from that, vascular malformation is there in swellings. And vascular malformation, there are different types of vascular malformation: Salmon's patch, portwine patch, strawberry angiomas. All these things you read and come. Okay, I'll just discuss. Can anyone tell me the difference between a benign and a malignant swelling? Anyone? This is there in pathology, right? You guys have read this and come. Difference between a benign and a malignant swelling. Yes. Okay. That is point 3 or 4. Then mostly benign swellings are soft, malignant is hard. Okay. Okay. Anyone else? Huh? Okay. Mobility, it is usually fixed. It is not. It is a little mobile. Okay. Okay. When does a malignant swelling becomes painful? Okay. Apart from that, if not inflammation, then apart. No, I am saying when does a malignant swelling becomes painful? Involves the nerve or becomes infected. Okay. Anything else in malignant swellings? What about margins? Irregular, and you feel the margins in a benign swelling. Okay. Vascularity. Okay. Okay. Yes, that is why the margins are well palpable. Okay. No, malignant swellings. Yes. Okay, you get a patient with swelling. What is your line of management? How will you manage a case? Okay. Somebody apart from you? Anyone? This is what final year is about, right? When a patient comes to you, let's say a patient comes to you, sir, I have a swelling. What do you do? You are sitting in the OPD. Tell me, what do you do? That is what you are going to tell the patient. Okay, history, then inspection. Okay, then okay, let's say you've come on to a diagnosis. Okay, not provisional diagnosis. Then if you are not able to come to a diagnosis, then what will you do? Biopsy. Biopsy. Yes, investigations you will do. Investigations, yes. Okay, what investigations would you like to do? Directly. Yes, first should be USG, right? Basic blood examination, then USG. After that, biopsy.